Into the Fold is a podcast on mental health issues, produced by the Hogg Foundation for Mental Health. I'm your host, Ike Evans.
Well, in a nutshell, it simply means that mental health is far too important to be left to mental health professionals. I think the science tells us very clearly that the narrow biomedical approach that has dominated mental health care in recent years, in fact, I would say for much of the last 3 or 4 decades, it's not in fact a tenable approach, because mental health can best be described as a dimension rather than in binary categories of diagnoses or cases. This means that there is a potential role for a much wider range of providers, indeed, starting with the person themselves in terms of self-care, but moving on to people who are in community settings who might be able to support those who are having early signs of difficulties with their mental health, let's call it distress, helping them cope with that distress and perhaps preventing their slide into much more serious mental health problems. So there is a role for mental health professionals, of course, but the dominating role that has dominated the way we've allocated resources and thought about mental health care is one that I think my slogan, mental health for all by all, rejects. One of the concerns people often have had is that experiences to do with mental health and mental health problems won't travel well across cultures, because mental health is so deeply intertwined with our social and cultural world. Work done by people in low resource and diverse settings around the world over the last 2 decades has largely shown that the experience of mental health and mental health problems is actually quite similar across diverse contexts and cultures. Of course, this is not to say that cultural factors are not important. Cultural factors are important in many ways, but not just for mental health, across all health concerns, indeed, in all aspects of our lives. But at their core, the experience of good mental health or the experience of mental health problems is very, very similar across different groups of people, different contexts, and different cultures. Now, this is actually a very important scientific discovery, actually. It also opens the door for us to be able to learn from one another and not to be constantly fearful that because something was discovered or done in an innovative way in a different cultural context, it might not work in ours. Instead, we can open our minds and say, how can we embrace these innovations that happen in other parts of the world and bring them to our part of the world?
For example, when we had our first leadership exchange, when we had our second leadership exchange in the US, we held it in San Francisco. And in many countries, when you have an international setting, the indigenous leaders who are on the land first welcome everyone onto the land. And I think it was the first time in the US where you had a non-indigenous conference in San Francisco, where the indigenous leaders who were on the land first welcomed these international leaders. And it was a learning process whereby, for the first time, we realized at a conference that we were on land that had been settled thousands of years prior to the Europeans' arrival. And so when I look at these things happening, you know that we've been able to get some successes. When I have a leadership exchange, or if I'm in Washington with a group of leaders, I find that sometimes I just can't, I have to pinch myself, because I look at 20 or 30 people and they're all my friends. And they're all people who have immense passion, who basically have made major changes. And I just sit there thinking that I've been able to put them together. I've been able to match them together, and that to me was, I love that. What I'm hoping to do in the future is to work with low and middle income countries, WHO, to see whether or not there's some way. We've got a project right now with WMHL and WHO to look at, is there a way that we can mentor leaders in these low and middle income countries from people who have gone through a variety of skill sets, especially at the national level. And I think that's, to me, low and middle income countries, I think, are a gold mine for new ideas and innovations, because they have very little funds and are very creative.